Like a sigmoidoscopy, a colonoscopy involves viewing the rectum and the colon from inside the body. In a colonoscopy, the entire colon can be viewed. A flexible tube allows the doctor to see polyps or abnormal growths. If any are found, they can be partially or completely removed right then for further testing.
I think the advantages of having a colonoscopy over other procedures to screen for colon cancer are that it is more complete, it looks at more of the bowel, and also the fact that the procedure itself, while technically more invasive because it examines more of the bowel, is actually less painful. As a matter of fact, it's not painful at all.
Sedation is used for a colonoscopy, which is why it's usually not uncomfortable. That also makes it riskier, more complex, and more time-consuming. Different kinds of prep are used to clean out the bowel before a colonoscopy. Some find the preparation difficult, others not.
I think the biggest disadvantage of the colonoscopy is just the prep. The fact that you've got to go through this physically exhausting clean out. And for some people it can be very painful, I've heard. I was very lucky. I didn't have any pain at all during that.
It was a couple of hours before I started going to the bathroom. And then it seemed like every 10 or 15 minutes for hours until I, cleared out my whole system.
During the colonoscopy, you'll be sedated with medication, generally given through a vein. Patients differ in how much discomfort or unpleasantness they have. Some report none, others more.
The doctor inserts a tube in your rectum, and you can watch it on a TV screen. I found it kind of interesting. It just captured my attention, but I was sort of out of it because of the sedation.
Afterward, you'll need time to recover from the sedation, and you'll need someone to drive you home. People are not able to go back to work the same day, and about a third of them need another day to recover at home before returning to work.
After I had the procedure, the nurse told me I had to stay lying down in the little bed for 30 minutes. I didn't feel sleepy or dizzy or anything. She did have me go into the restroom, and she said I need to expel a lot of gas. Apparently they pump gas inside somehow, and I did do that, and I did expel a lot of gas. But it wasn't uncomfortable, and I had no bad effects, no really lasting effects.
Once I woke up, I was fine. I obviously couldn't drive, but my wife came to pick me up, so that wasn't an issue. And by evening, all effects of the anesthesia had worn off.
Complications from colonoscopies are uncommon. When polyps are removed, about 1 in 100 cause bleeding that requires being admitted to a hospital. For about 1 in 1,000 patients, the bowel is punctured and may need to be repaired surgically. Not all health plans will pay for a colonoscopy, and other out-of-pocket costs may be involved. Depending on where you live, you may need to travel some distance to find a doctor who specializes in it. If no abnormal growths are found, it's recommended that a colonoscopy be done every 10 years. Some people choose colonoscopies as their screening test because the colon can be examined and any polyps can be removed in one procedure. However, for most people, 80 out of 100, no polyps or problems are found, so there's nothing that needs to be removed.